This is my audience for my speech today. Hi, my name is Robin Cloxton. I'm going to do a speech today on a surgical hand scrub. I'd like to propose that a surgical hand scrub is the most important piece of equipment. Our hands are the most important piece of equipment we have in the operating room environment. The reason for this is because we need to keep our hands as clean as possible because that's what we use the most often in surgery. We use instruments, hemostats, and scissors and things like that, but our hands have to touch all this stuff. So we have to keep them as clean as possible when we're doing surgery. I'm going to start demonstrating how to do the surgical scrub. I took off my watch. I don't have any rings on. My fingernails are short. They're not supposed to be too long. They're supposed to be less than a quarter of an inch long so they don't poke through your gloves. The way you start the surgical hand scrub is to turn on your water. I open my surgical brush, which has some Hibiclens in it. I'm going to start off by rinsing all the way up past my elbow, fingertips to elbow. And I will start out by using the little nail file that's in here. It's not a file, it's a cleaner, to clean under my nails. Now, in my facility, our recommended time for doing a surgical hand scrub is between 2 and 6 minutes long. So I have a clock there. I'm going to try to keep it, going to make it more than 2 minutes, but less than 6. And this speech cannot go past 7, so that's another reason to keep it short. So I use that, discard it. I get this, discard that. Sometimes I don't hit the trash can. I'm going to tell you that you've probably all seen pictures or videos of surgery on television on different shows. And I will tell you that as a surgery nurse, I've been one for over 30 years, and I do scrub in surgery and I circulate. You don't actually go into the operating room with clean hands and no mask. I'm not wearing a mask today so that you can hear me talk. I divide my hand into 4 planes. I do scrub brush on all 4 planes. So this is 1, 2, 3, and 4. I did my fingernails first. 1, 2, 3, and 4. And 1, 2, 3, and 4. Then I do the tops, palms, and then I go to the other hand. Start on my fingernails. That's the dirtiest part. 1, 2, 3, 4. And I continue this process till I finish my hands. I wanted to tell you that one of the reasons that we're doing this is because we're going to try to prevent surgical site infections. Surgical site infection is any infection that occurs on a surgery patients within 10 days of surgery. I guess it's our government, Joint Commission, the people that accredit our hospital, and the CMS, Centers for Medicare, Medicaid, they have decided that they will not pay for readmission on patients when they come back to the hospital within a certain amount of time. So we need to be vigilant and keep surgical site infections. We'd like to have them none. So I finish with my hands. I'm going to use this side. It's not so harsh on my arms and divide my arms into 4 planes. I'm trying to keep an eye on the clock as far as my scrub time goes. The Joint Commission, which is our accrediting body for our hospital, has set hand hygiene as one of their national patient safety goals, and they want us to make sure that everyone is doing good hand hygiene. Now, not everybody will be doing a surgical scrub because it's just not necessary on normal floors, but it is very necessary to wash your hands all the time. So I have done my entire scrub now, and I think it's been over 2 minutes. So I'm going to start with my fingertips. I'm going to wash or rinse this arm. I'm going to rinse this one. And if you'll notice, I'll keep my arms like this. I want my fingertips to be highest up. I want the water to drip off my elbows because I don't want the water from my elbows to come back and contaminate my hands. Also, we have learned through research that micro holes occur in your gloves during surgery. And the longer the surgery, the more holes you get. So keeping your hands as clean as possible is the most important thing you can do to prevent infection. So right now, I would go into the operating room and get on my gown and gloves. That's all my demonstration for today. Thank you for listening.